Afternoon, everybody. We're going to begin our joint COVID-19 press briefing. This is a joint Nueces County, City of Corpus Christi press briefing on COVID-19, and we had been doing these every day for the past 3 months or so. We've reduced the format, but haven't reduced the amount of information going to the community. Everything we present here is on our website. There's a web page that both the city and the county share, and that's updated daily throughout the day, depending on what's going on. We do make appearances now on Wednesday to just meet the public via some of our news coverage channels, as well as on our Facebook page, YouTube, and so on. And so I'm here today. I'm Corpus Christi City Manager Peter Zanoni, and Annette Rodriguez, our Health Director, will speak a little bit today. We have Mayor McComb, who's here today. He's going to speak on, let me see what happened to that summary page I had. Well, I don't have it. Mayor McComb's going to talk a little bit about what's going on in the city, as well as what's going on in the state in terms of some of the governor's orders. And the same with Judge Canales. She's going to talk about some of the new opening Texas orders that the governor has released as recently as even yesterday. What I'll provide today is an update on our statistics. We provide that every day to the community on our website. It's there today, but I'll verbally go over it this afternoon. And then also I'm going to provide a quick update on our first responder quarantine situation. About 2 weeks ago, we placed police officers, firefighters, and some of our detention center staff in quarantine because they can't, all those, the police and the detention center personnel came in contact with a suspect who was arrested and later released, and he had COVID-19, so we put those folks in quarantine. But I'll give you an update on them, as well as 2 firefighters that transported a person that had the virus as well. Okay, so every day at 4, we look back at the past 24 hours to see what has changed and what number of new cases we may have picked up, if any, and then also the change in status for those that may be in the hospital. And so since yesterday at 4 o'clock, we are reporting 2 additional cases. You can see on our graph here. This last week has been much better. We may recall some of the high numbers. That was in part to 2 outbreak areas in the city, to include a beef processing plant, as well as 2 transitional housing complexes, as well as some senior centers or senior facilities. But you can see we've had a couple of zeros this past week. 2, a 3, and a 2 today. So that brings our total cases over the past 3+ months to 268 total cases. But we do have and I'll share with you momentarily, a recovery rate. So the active cases are only 125 out of that 268. There are still only 3 deaths in Nueces County, 2 from the city of Corpus Christi, 1 from Robstown. The distribution in male, female is still more in the male side. There's 59% male, 41% of all the cases are female. And then the majority of our cases in terms of age distribution, we have 9 age groups that we place the persons in to track. And most of them are in the ages of 20 through about 60. And that accounts for the majority of the cases. Although there's some in every age group, including 16 in the 0 to 19 age group, and we even have 1 in the 90+ age group. Testing is important, and we report on that every day. So today, between the city and private entities, to include hospitals that have sent specimens to LabCorp and other commercial LabCorp or Quest commercial labs, between the city and the private side, we've tested 252 persons since yesterday. That brings our total tests to date at 8,816. And when the mayor speaks, he'll talk about the positive rate, which he's been tracking, and I think we'll have a graph from him. So that means that the number of persons we test, there's fewer and fewer persons that are positive, and the lower that number, the better. And so it was in the 3-point-somethings, but it's dropping down now to right around 3, and soon it'll probably drop below 3, which is a good thing. Okay, the number of persons in the hospital recovering from COVID is 7. It had been 6 for many days. It went up just since yesterday to 1 more. So there's 7 in the hospital that have COVID that are recovering. Of those 7, 2 are in intensive care, and then the others are just in general care. And then we have our donut here that shows the, by slices, the confirmed active cases and then the recovered cases. So 140 persons have recovered, or 53%. So the majority of the cases are in a recovery situation. They've recovered. We still have 125 active cases, as I mentioned. And then we look at where are the folks. So most of them are in the city of Corpus Christi, since it's the biggest city in Nueces County. The two additional since yesterday, they were both Corpus Christi residents. And let me see. We're going to show you two graphs now that we've been showing for several weeks. And it just shows some trending data for us. This first one is the number of tests performed. It shows by the blue spikes how many tests per day. And the big peak areas over here, that's when we were doing the beef processing plant and some of the transitional housings. You can see the orange line, which is a 7-day trending. It's a snapshot using a 7-day average. And that is 205 tests is the running average for the past 7 days. You can see it's declining a little bit, and that's in part because the National Guard has concluded their work. We're not testing any big plants or any other big institutions, so it's kind of trending down, which is okay, because those outbreak areas we don't want. And so 205 on average. And then when we look at, this is even a better graph though, when you look at the number of cases, number of positive cases, you can see the high peak was because of those 2 to 3 incident outbreak areas, the meat processing plant and the transitional houses, as well as some of the senior centers. But since that time, it's dropping significantly, and our 7-day average cases is 1.7 per day. So 1.7 positives per day, which is good. It was much higher when we had that big peak. We're getting close to our all-time low, which is over here, around the 24th of April. And so as we progress through May, we're hoping that it'll continue to trend down. Annette's going to talk to us about how we can make sure it continues to trend down by following what we've been saying for 4 months about how to stay away from COVID and not catch it. One other thing on this is on Friday, Dr. Bird will be here presenting again. I know some of our followers like to listen to him, but he talks about a transmission rate. And that means one person transmits the virus to so many people, and that so many people transmit it to more and more people. So we were at our high point between a 1.3 to a 1.6, a range of transmission. Based on this last couple of days or weeks data, we're down to less than a 1.0, so 0.98 transmission rate, which is good. That's what we want. Anything below 1, I think, we were at 0.5 at one point, but anything below a 1 helps to extinguish the virus. So he'll talk to us more about it on Friday, but that's a good indication as well that if we keep on this course, we may be doing some pretty good things for our community. Okay, so that concludes the statistics. I'm going to just do one update on our first responders, then Gabby will translate everything I've talked about, and then we'll have Annette come up and talk about some of the ways we can continue to stay healthy in the community. So about 14 days ago, we had 2 firefighters, 4 police officers, and 7 detention staff placed into quarantine because of 2 different incidences where a person they came in contact with had COVID-19. The 2 firefighters were released yesterday. That concluded the 14-day period. And tomorrow, today, late tonight, the 4 police officers will be released. They'll be back in the job tomorrow for the 4 police officers. And then the 7 detention staff also will be back at work tomorrow. They'll be released from quarantine tonight. So with that releasing of those 11 persons, the 4 police and 7 detention, and the 2 that were already released yesterday, the 2 firefighters, we will have 0 persons in quarantine in terms of city staff members that, especially first responders that had been put into quarantine because of somebody or a patient that they came in contact with that had COVID-19. Okay, so that concludes my portion of our briefing today. Gabby is going to translate it, into Spanish, and then Annette's going to come on up and talk to us. Thank you.
Las cifras más recientes indican que en las últimas 24 horas se han reportado 2 casos nuevos confirmados por el coronavirus, haciendo un total de 268 casos. 159 son hombres, 109 son mujeres. La mayoría se encuentran en el rango de edades entre 40 y 49 años. A la fecha se han llevado a cabo 8,816 pruebas por el virus entre el Distrito de Salud Pública, laboratorios privados y la Guardia Nacional. 140 de los 268 casos se han recuperado por completo. 7 personas continúan en el hospital. 2 están en la unidad de cuidados intensivos y 125 casos aún están activos. En cuanto a los oficiales que han sido puestos bajo cuarentena, 4 policías y 7 empleados del centro de detención habían sido puestos bajo cuarentena al estar en contacto con un sospechoso quien era portador del virus. Ya todos ellos han sido dados de alta. En otro incidente por separado, 2 paramédicos habían sido puestos bajo cuarentena luego de haber transportado a un hombre al hospital. Esos 2 oficiales también están ya dados de alta.
Thank you. Annette Rodriguez, Health Department Director. Today we're going to talk about some frequently asked questions. And Gabby and I are going to go back and forth between English and Spanish. So the first question is, where can I go to get tested for COVID-19? The answer is, call Amistad Clinic at 361-886-3065. They're conducting drive-thrus daily. And or the military testing team at 512-883-2400.
Vamos a estar presentando varias preguntas y respuestas de las más frecuentes. La primera pregunta, ¿dónde puedo ir para hacerme la prueba del coronavirus? Llame a la Clínica Amistad al 361-886-3065 o a los equipos de pruebas militares al 512-883-2400.
The question is, can someone test negative and later positive on a viral test for COVID-19? The answer is yes, it is very possible. You may test negative early in your infection and then test positive later during the incubation period. You could also be exposed to COVID-19 after the negative test and get infected then. Even if you test negative initially, you should take all necessary precautions to reduce your risk of exposure.
¿Alguien puede dar negativo y luego positivo en una prueba viral para el COVID-19? Sí, es posible. Puede dar negativo en el inicio de la infección y positivo en el periodo de incubación. También podría exponerse al virus después de la prueba negativa y luego infectarse. Incluso si su resultado es negativo, debe tomar todas las precauciones necesarias para reducir su riesgo de exposición.
The question is, what is antibody test? An antibody test checks a sample of a person's blood and looks for antibodies to COVID-19. A positive result may mean that a person is or was previously infected with COVID-19. Antibody tests should not be used solely to diagnose COVID-19.
¿Qué es una prueba de anticuerpos? Las pruebas de anticuerpos verifican una muestra de sangre de una persona y buscan anticuerpos que causan el COVID-19. Un resultado positivo puede significar que una persona estaba previamente infectada con el virus. Las pruebas de anticuerpos no deben usarse para diagnosticar únicamente el COVID-19.
The question is, why do I have to practice social distancing? The answer, the virus is known to be transmitted mainly from person to person through respiratory droplets that are produced when an infected person coughs, sneezes, or even talks. Studies suggest that these droplets travel around 6 feet distance. Keeping a distance of 6 feet or more from individuals can greatly reduce your risk of exposure to the virus.
¿Por qué tengo que practicar el distanciamiento social? Se sabe que el virus se transmite principalmente de persona a persona a través de secreciones respiratorias producidas cuando una persona infectada tose, estornuda o habla. Los estudios sugieren que esas secreciones viajan alrededor de 6 pies. Mantener una distancia de 6 pies o más de las personas puede reducir en gran medida el riesgo de exposición al virus.
Question is, I am having trouble breathing. What should I do? The answer, if you develop trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, and have bluish lips or face, call 911 and notify the operator that you may have COVID-19.
Tengo problemas para respirar. ¿Qué debo hacer? Si desarrolla problemas para respirar, dolor persistente, opresión en el pecho, nueva confusión, incapacidad para despertarse o permanecer despierto y tener labios o cara azulados, llame al 911 y notifique al operador que puede tener COVID-19.
The question is, my grandmother is immune compromised. What should I do? The answer, keep your grandmother away from people who are even mildly ill. Avoid taking her in the general public unless to seek medical attention. When doing so, have her wear a mask and practice social distancing.
Mi abuela está inmunocomprometida. ¿Qué debo hacer? Mantenga a su abuela alejada de las personas que incluso están levemente enfermas. Evite llevarla al público en general, a menos de que busque atención médica. Al hacerlo, haga que use un cubrebocas y practique el distanciamiento social.
The question is, I got tested at one of the military testing team sites. Can I get my results from the health district? The answer is the military testing team will contact you if you are negative, and the health district will contact you if you are positive.
Me hice la prueba en uno de los sitios del equipo de pruebas militares. ¿Puedo obtener mis resultados del distrito de salud? El equipo de pruebas militares se comunicará con usted si es negativo, y el distrito de salud se comunicará con usted si es positivo.
The question is, I got tested yesterday, and I have not received my test result. Why is it taking so long? The answer, it depends on where you got tested and the volume of test in the queue for that laboratory to which it was sent to be analyzed.
Me hice la prueba ayer y no he recibido los resultados de mi prueba. ¿Por qué tarda tanto? Depende de dónde se hizo la prueba y el volumen de pruebas que estén esperando en el laboratorio al que se envió.
Question, should children wear masks? Answer, the CDC recommends everyone 2 years and older wear a mask that covers their nose and mouth when they are out in the community. Face coverings should not be put on babies or children younger than 2 years of age.
¿Deben los niños usar cubrebocas? El Centro para el Control de Enfermedades, o CDC, recomienda que todas las personas mayores de 2 años usen un cubrebocas que les cubrirá la nariz y la barba cuando estén en la comunidad. Las cubiertas faciales no se deben de poner en bebés o niños menores de 2 años.
Question, I have COVID-19. Does my family now have it? Answer, not necessarily. There are steps to take to reduce your family members from exposure to the virus, such as isolating yourself in a separate room. Wash your hands often or clean your hands with 60% base hand sanitizer. Your family should also disinfect often and wash their hands frequently and avoid using the same space as you do until you have completely recovered.
¿Tengo el coronavirus? ¿Toda mi familia lo tiene ahora? No necesariamente. Hay pasos a seguir para reducir la exposición de su familia al virus, como aislarse en una habitación separada, lavarse las manos con frecuencia o limpiarse las manos con un desinfectante para manos a base del 60%. Su familia debe desinfectar con frecuencia, lavarse las manos con frecuencia y evitar usar el mismo espacio que usted hasta que se haya recuperado por completo.
Question, where can I buy a mask? Answer, try your local grocery store or pharmacy, or you can make your face covering at home using everyday cotton material such as a t-shirt.
¿Dónde puedo comprar un cubrebocas? Pruebe en sus supermercados o farmacias locales, o puede cubrirse la cara en casa utilizando material de algodón cotidiano, como una camiseta.
Question, I feel ill, but I do not have a vehicle to go to a testing location. What do I do? Answer, we advise that you self-isolate and monitor your health for 14 days. If your symptoms worsen, you must call 911 and let the operator know that you have symptoms of COVID-19.
Me siento enfermo, pero no tengo un vehículo para llegar a un lugar de prueba. ¿Qué hago? Le recomendamos que se aísle y monitoree su salud durante 14 días. Si sus síntomas empeoran, llame al 911 e infórmele al operador que tiene síntomas del coronavirus.
Question, what is quarantine? Quarantine is a term used to keep someone who may have been exposed to someone with COVID-19 or may have COVID-19 away from others.
¿Qué es la cuarentena? Cuarentena es un término utilizado para mantener a alguien que puede haber estado expuesto a alguien con COVID-19 o que puede tener el COVID-19 lejos de otros.
Question, what is isolation? Isolation is used to separate those who are sick with COVID-19 from people who are not infected.
¿Qué es el aislamiento? El aislamiento es separar a aquellos que están enfermos con COVID-19 de las personas que no están infectadas.
And the last two questions. Question, can I get COVID-19 from mail or packages? Answer, at this time there is no evidence that the virus can survive for a prolonged period of time on packages.
¿Puedo obtener COVID-19 por correo o paquetes? En este momento no hay evidencia de que el virus pueda sobrevivir durante un periodo prolongado en el correo o en los paquetes.
And the final question is it safe to go to a restaurant or visit any other business that is open? Answer, when going out into public, your best defense is your own behavior. Avoid people who are sick, wear a mask, practice social distancing, and avoid crowded areas. Ensure that the place that you are in has safety protocols in place to protect your health and those around you.
¿Es seguro ir a un restaurante o visitar cualquier otro negocio que esté abierto? Al salir a público, su mejor defensa es su propio comportamiento. Evite las personas enfermas, use un cubrebocas, practique el distanciamiento social y evite las zonas abarrotadas. Asegúrese de que el lugar en el que se encuentre tenga protocolos de seguridad para proteger su salud y la de quienes lo rodean.
Thank you. Stay well, stay protected, and as always, stay informed.
Good afternoon, everyone. I'm Barbara Canales, Nueces County Judge. It's good to be with you this afternoon. And I'd like to start by giving everybody an update. You know, these press briefings are excellent to get the most up-to-date information about COVID-19, about the response to COVID-19, about our economic recovery, but it's also an important opportunity to just talk about emergency management and how we deal with crisis and how we can get the most up-to-date information to the community. So I'd like to address some information that came out, I believe, yesterday, but I had not had a chance to weigh in or comment on it, and that has to do with the Naval Air Station Corpus Christi shooting that occurred last week. The latest news from the FBI and Houston field office is that they have determined at this time there is no imminent threat to public safety in the Corpus Christi community. That is worthy of repeating. There is no imminent threat to public safety. So far, all evidence points to the shooting being a terror-related incident, and it is being investigated as such. The shooting that occurred last Thursday at the Naval Air Station Corpus Christi does remain an active investigation, and while there was initial concern about a potential second person of interest, intense investigation leads the FBI to believe there was not. The FBI is not searching for a second person of interest, and the sole attacker is believed to have acted alone, and he died at the scene. I would like to join the FBI in commending the heroic actions of Master-at-Arms Petty Officer Second Class, who risked her life and did not hesitate to engage the subject, as well as the actions of the Navy security forces, who likely stopped what could have been a much more deadly attack. I would also like to extend my appreciation for the FBI agents and all these support employees, as well as our own law enforcement partners, including the Corpus Christi Police Department Chief Merkel, who continue working countless hours to investigate this case. Tips from local citizens have been very helpful, and we want to thank those in our community who have been calling the FBI tip line to provide additional information. Anyone with knowledge about this incident should report it to 1-800-CALL-FBI. Please remember, there is no detail too small to share. Again, there is no imminent threat to public safety in the Corpus Christi community and the greater Nueces County community. And the FBI, once again, is not searching for anybody else. So let's pivot as we talk about the emergency that is at hand, and that emergency is twofold. As we often talk about the public health emergency, there's also an economic emergency that is taking place as a result of that public health crisis. And yesterday we had some breaking news, and I wasn't here to deliver it, so I'd like to share with you the highlights. On May 26, Governor Abbott issued a proclamation to amend the current open Texas orders. I have issued new orders aligning our Nueces County orders with the governor's orders. I will tell you that I just looked them over. I need to sign them and file them with the clerk. I'll do so first thing in the morning, and they'll be on our website. Once again, as we have done so many times in the past, Nueces County follows the governor's lead. Just as a reminder, as county judge, my emergency powers allow my orders for Nueces County to be more restrictive than the governor, but I cannot be less restrictive. And I wanted to point this out and actually highlight this today because it came up both in discussion at the courthouse with an economic advisory council, as well as on several emails I received where there was a misunderstanding that there could be a way that I could do something different than the governor's orders, and that is not the case. His supersedes our orders. We're following the governor's lead. We think that's the right leadership to take, and I could be more restrictive, but we are not at this time. So when the governor moved the capacity limit for restaurants from 25 to 50% last week, I had a choice. I could either mirror that, which I did, or we could raise, as I did, which raised the capacity limit to 50%, or if local conditions warranted it, we could keep it at 25%. But we stayed and mirrored the governor's orders at 50%. And I just want to make sure everybody understands the difference in the emergency powers. And so what I can do is be less restrictive. If the governor's orders only allow 50%, I can't, for example, decide to go to 100%. And so I think there was a lot of misunderstanding that people could come and really say, but you can do more. The answer is I cannot do more. And I would not want to do more at this moment because we want to make sure that we are consistent and that we are following the governor's orders at this time. So again, his orders supersede mine, and that is how we are mirroring his latest orders to date. Throughout this emergency, I have been driven by the data, and the data has informed all of our national and state leadership, but of course it's highly influenced my decisions on how to implement the state orders locally, and to this point I've always mirrored the governor's orders, and that is what I'm doing again tomorrow morning when I sign the latest ones. So these orders make the governor's orders and limits effective in Nueces County, and here's what's changing. So if you're taking notes on what happened yesterday, here are some of the most important highlights for our county. Water parks can be open Friday, May 29th, and this is going to operate at 25% of capacity. Video arcade areas within water parks must remain closed. Adult recreational sports, and this is really focusing on our adult leagues, not our sports youth leagues. They can resume Sunday, May 31st, but games and competitions may not begin until June 15th. Driver education programs can resume immediately. Food court dining areas within shopping malls can immediately resume operations. Malls are discouraged to designate one or more individuals who are responsible. I said that wrong. Malls are encouraged to designate one or more individuals who are responsible for ensuring health and safety practices are followed, and that includes limiting tables to 6 individuals, maintaining that 6-foot distance between individuals sitting at different tables, cleaning and disinfecting the tables, and ensuring no condiments or other items are left on the tables between customer uses. And when we apply all of these rules, they're going to make us all safe, but guess what's going to happen? That food court's going to be able to open again. And yes, once again, the line for Chick-fil-A will be out the door. So let's talk about what happened this weekend. We had Memorial Day, and I don't think it's a big surprise. I'm certain everybody saw on the news the beaches were as crowded as, quite frankly, I have ever seen them. But we had a lot of positive reaction to people really responding to our law enforcement controls and patrols. And I want to thank Coastal Parks, who did an amazing job trying to keep up with all of the really just the voluminous amount of people with regards to beach permits and regards to the trash. And so we really had to hustle this weekend. And we are an incredibly resilient county in that we're constantly being able to pivot and make adjustments where we need to. So thank you to Scott Cross and your entire team. Thank you, Bobby Sherwood, and all of your constables helping us patrol, to CCPD and to Sheriff Hooper. Let me just say this is a complete event when all of us know that we need to make sure public health and safety are paramount, particularly on these very busy weekends. However, our goal has always been education and not enforcement. And here's what I think the bigger message was from the weekend. People are going to want to go on vacation. They want to get outside. They want to enjoy the natural beauty that is our coast. And Nueces County is going to be a destination and the number one choice for many, many people. And I'm excited about the prospects for our economic recovery. And I'd really like to highlight that today, specifically because although we had Commissioners Court, today I spent some time with the members of the Nueces County Development Commission, as well as our Economic Advisory Council, chaired by Wayne Squires. And we also had a very robust discussion at Commissioners Court regarding our economic recovery. And here are some few takeaways that I want to share with you. Number one, we are working to make sure that we get every dollar of reimbursement from our federal and state resources. So there are federal FEMA dollars to go after, there are CARES Act dollars, and then there are community dollars that are going to come through our COG, and even dollars that have been allocated to our other political jurisdictions that we all need to seek reimbursement from. We are working to make sure that our business access the resources that are already available to them directly, and you can find all of that information on our website. And we are also focusing on getting funds for the resources that can help individual people and families directly, including mental health. I also heard from different members of our business community today, and while they appreciate all those efforts that I've just mentioned, this is what I also heard. I heard that we need even more programs, we need more grants, and we want to get back to work. I want you to know that I'm behind you 100%, and every day we know more, we have more data, we have more resources, and pretty soon I hope we have real dollars, real cash to help small businesses in our county recover. So we have shown that if we take an action, a proactive stance on aggressive testing, with local test processing, we know that we can produce fast results. With thanks to our partners at the Health District, the city, the state, the Texas National Guard, our local hospitals, and our countless medical professionals. You know what we've shown? We've shown that we can open Texas safely here in Nueces County. And I can't get ahead of the governor, but I can tell him that we're ready and we're able to move forward if the data drives those policies. And right now, based on the numbers that we just saw, based on the numbers we've seen over the past few days, we definitely see a decline in our cases, and that's a good thing. So I want to remind you of some words that sometimes when we do these press briefings, you know, most of the time I ad lib or I tell you what has transpired during the day, and sometimes I put my talking points together. But always I tend to return to the things that not only ring true to me, because I know I can deliver them with that integrity, but I believe when I do that, that you hear me with the way that it's meant, and that is this: through every storm, on the backside of that storm, there are always sunny days ahead. And I believe that this weekend was a preview of those sunny days ahead. And it's not just for our beaches, it's for our restaurants, our hotels, our retail shops, in fact, all of the hospitality industry. I went out multiple times over the weekend. I did practice that safe social distancing. I did enjoy restaurants that were also practicing the right way to do business, and it felt good. And everywhere I went, I engaged in robust discussion and conversation. From chefs to bartenders to servers, I asked them, tell me about the weekend. Everywhere I went, they said we had record sales. We had more business than we've ever seen for the month of May. And I want to say thank you to Nueces County for not only from the business community, but from all of us who know that part of our recovery means having a little faith, making sure that we all trust one another enough. So keep doing it right and keep helping our local businesses recover. There's no doubt that there's going to be tremendous challenges still that lie ahead. But I do believe that that backside of that front, that's when the prettiest weather is, isn't it? That's when the bay is at still and calm, and there are no waves. It's just that beautiful, beautiful sunrise that you see in the morning after that storm. And that's what I'm envisioning for Nueces County, and I want you to close your eyes and put that vision in your head and make that a part of our recovery too. It's part of our mental recovery, knowing we're going to get there. And with the help of our Nueces County Economic Advisory Council, with the help of the Nueces County Development Commission, with our federal partners and our state partners, and with the money that's already come to us in allocation, we will recover. Thank you, and I stand by for questions.
En resumen, en cuanto a la balacera ocurrida la semana pasada en la base naval, no hay evidencia de que exista una amenaza. El FBI continúa investigando. Ya no se busca a un segundo sospechoso y se cree que el sospechoso actuó de manera solitaria. Quiero agradecer a todas las agencias de ley que investigaron este incidente. Pero para aquellas personas quienes cuenten con información adicional, se le pide llamar al 1-800-CALL-FBI. El día de ayer el gobernador dio cambios en sus órdenes originales y yo he estado enmendando mis órdenes para reflejar las órdenes del Estado. En cuanto a los límites en los restaurantes, yo quise adherirme a las órdenes del gobernador y adaptar el límite en los comedores al 50%. Las órdenes del gobernador reemplazan cualquier orden de los gobiernos locales. El viernes 29 de mayo, los parques acuáticos están limitados al 25% de su capacidad. Las áreas de videojuegos permanecerán cerradas. El 31 de mayo, los programas de deportes recreativos para adultos pueden reanudarse. Los programas de educación para conducir pueden reanudarse de manera inmediata. En los lugares de comida, el área de comedor dentro de los centros comerciales puede reanudar las operaciones de inmediato. Las mesas están limitadas a un máximo de 6 personas. Este fin de semana las playas estuvieron abarrotadas de gente, pero afortunadamente se siguieron las órdenes. Le quiero agradecer al Departamento de Parques, a los condestables, a la oficina del alguacil y a la policía local. La gente va a querer salir de vacaciones en los próximos días y esperamos contar con una buena recuperación económica. Seguimos buscando fondos del gobierno para poder así solventar programas, incluyendo para la salud mental, así como para los pequeños negocios. Le quiero agradecer a todos los profesionales de salud, ya que podremos reabrir el Estado de manera segura al ver los números de casos positivos, ya que se nota. Y a los residentes del condado por su cooperación. Aún nos quedan muchos retos, pero sabemos que contaremos con su ayuda.
Thank you. Joe McComb, Mayor. Had an interesting visit today from folks at Gulf Coast Growth Ventures, and they were bringing me up to date on kind of their COVID-19 experience. And the good news is that because they took swift action early back in February and March, they did not have any interruption in terms of their progress over at their new facility. And to date, they've had no positive test results of their employees that have been working on their project. So that's very good news. And then even the better news is that their administration building is scheduled to be completed by the end of June, which means for our area, probably Portland, somewhere in San Patricio County, northwest Corpus Christi, that they will begin to start moving approximately 300 people from Houston and other areas to our area to begin to do their work here in that new administration building. So that's good news for us, and we're delighted that they were able to do that. But the best news was really that they had no COVID test positive, and they kept those 2,000, 2,500 people working over there on their plant. So we're delighted with that. On Friday, we had a Big City Mayor's conference call, as we do each Friday, and Senator Cruz was on there. And for those in the business community that might be watching or listening to this, we shared with Senator Cruz the concern that many had on the payroll protection plan, that if he would support, and he said he would, and Senator Cornyn has said he would, not necessarily more money for that fund, but for the extension of the initial 8-week period, because some of the businesses are having difficulty meeting their payroll requirements within that 8 weeks. And the reason for that is the money was allowed based on the same period a year ago. And while you kept your employees on, the revenue, the businesses, whatever your business you're in, is down. And so therefore, if they were subject and used to getting overtime, many of those employees did not get overtime during this 8-week period, or will during this 8-week period. And so therefore, they won't have the same payroll that they had 8 weeks for the same time period last year. So there is some talk in Congress, and I think both Texas Senators Cornyn and Cruz are supportive of that, and I think that's the direction we're moving on. And that would be good news for our local businesses, because it has been a lifesaver for many of them, at least some of the folks that I've talked with, and they're very thankful for that. The judge had mentioned we had a great Memorial Day weekend, and we did, and that's behind us now, and our next holiday weekend is July the 4th, and I know many folks have already started asking me about the Mayor's Big Bang celebration. Though the decision on that has not actually been made yet, and the governor referenced something about the 4th of July, and I think we'll hear in the next few days what the governor's take on that is, but I'm going to work to do everything I can that while we may not have a big party, we're going to have a big celebration, and hopefully we'll have the fireworks. It may just have to be from sitting in your car or whatever. But we'll see what the governor says. But I could almost assure you, in Corpus Christi, we're going to have fireworks on the 4th of July. Now, I can't go much further than that, and I may be overstepping my bounds there, depending on what the governor says. But I think based on his track record, he's as eager to get our state open and working and moving forward as anybody here there is, and I appreciate his efforts and all of that. The other good news is that we're continuing to test, and the county judge earlier said she wanted to have at least 2% of our population. That was a target to get tested to give us a better idea, and I think that's what the governor and the state was trying to do, is get a 2% test. Well, based on the numbers we have, with 8,816 people, using round numbers for Nueces County population, that means that we've tested 2.2% of our population, and that's using 400,000. If you want to use 350,000, that's 2.5% of our population. So I think, Judge, we've achieved our 2% goal. We're going to continue to test. But even the better news is that out of the tests that we've provided, the 8,816, the 268 positive results amounts to a 3.03% positive test to test administered, which is a tremendous number for us. And we want to bring that down to 2 to 1 to 0. But the bottom line is we're continuing, even though a few positives pop up every now from a population-wise, that means there's fewer and fewer among us that are testing positive, and that's a good sign. And so we just want to ask you to keep vigilant in what you're doing, continue to practice your social distancing, your personal hygiene, and pay attention to what you're doing. But I think our best days are ahead of us on this thing, and we're just going to have to stay vigilant and do that. But I'm very appreciative of the community's response and the adherence to the recommendations, even though sometimes we get a little close when you got a couple 100,000 people out on the beach and other places. But I hope that they will take precautions, and this will all be behind us as sooner than later. So that'll conclude my comments, and ask the manager and the judge if you have any questions. Or do you have any follow-up comments? All right. And so, okay.
En resumen, el día viernes tuvimos una junta con los alcaldes de grandes ciudades, incluyendo al senador Ted Cruz. Vamos a seguir trabajando para ayudar financieramente a los pequeños negocios. El próximo día feriado es el 4 de julio. Todavía no se han tomado decisiones. Esperamos escuchar primero por parte del gobernador. Ojalá podamos festejar con fuegos artificiales, pero ya le daremos información. Continuamos realizando pruebas de la detección del virus. Ya hemos realizado cerca de 9,000 pruebas, haciendo así un 2.2% de la población que ha tenido la prueba. Afortunadamente, cada vez son menos los resultados positivos. Esperamos que esta fase concluya pronto.
Okay, thank you. That concludes our remarks for today. We're here to answer any questions that may be. And before we take any questions, just a quick recap on the week. So this takes care of the press briefing for the week. We'll continue to provide daily updates through our website. That webpage is on the county and the city's website. And we also have a nice dashboard that's available from your phone if you want to view it from there. Now, the next event is Friday at 3 o'clock. The Texas A&M Corpus Christi team will be here. That includes Dr. Bird, Dr. Tussaud. They have a bigger team. It's just 2 folks that come here because of social distancing, but they continue to update modeling and show trends and projections. And so this Friday at 3 o'clock, they will be here. So it's a change from our traditional 5 o'clock, but 3 o'clock, same channels and venues that you watch for this, you'll watch on Friday at 3 o'clock. And then we will be back, the judge, the mayor, myself, Annette Rodriguez will be back next Wednesday for another briefing with the community. But all the information is available on our website, webpage, and check in there if you have questions between now and then. So with that, we're here to see if there's any questions from the media today. Courtney?
I believe this will end up being for Annette.
Okay, Annette?
We have a total number of people tested in nursing homes and people that tested positive.
So to date, we've tested nearly 1,600 people at the nursing homes. As of yesterday, when the testing was completed, as of yesterday, all of them were negative. So the only positives we had were the ones that we told you about early on that were asymptomatic. And that's where we're at. So we're still testing the ones from today.
Do we have an update on the number of cases at the Avalon facility?
At the Avalon,
Yeah.
24 cases to date.
Our total number of positive tests that we've had, are those just from swabs, or do those include antibody tests?
They're all from swabs except for one. One is a probable case, and that's from an antibody test that was put in that case definition for probable.
That's all, thank you.
Okay, those were good questions from the Caller Times, thank you. Do we have any other questions for today? Okay, then that concludes our press briefing. We'll see you back here Friday at 3, and then back for the next press briefing next Wednesday at 5. We'll see you then, thank you.